Recording then. So everybody, this is Dr. Miskulin. He is an optometrist, and welcome, Dr. Miskulin.
Hello.
Hi. So this video is going to be played during our club meeting on for the December month, hopefully. So the December month is going to be focused on vision. So we have a couple of questions for you, which our club has gathered. So I'm just going to go ahead and I'll ask you, and then you can tell us what you think. So first of all, why did you choose the medicine field? Why healthcare?
Yeah, well, I wanted to go medicine from a young age. I decided on optometry specifically, probably, I don't know, junior high, freshman year. I mean, I knew it from a young age. I had a lot of eye issues with myself personally, and then my family. My grandmother had some very bad glaucoma, some botched cataract surgeries. And so I was like, well, I kind of want to help out on that. So that's what kind of pushed me down optometry specifically. When I was deciding, I was like, okay, optometry is certainly one thing. And then, there's dentistry in my family, got a lot of dentists. So I was like, I don't really want to do that. They can stay to the teeth. I don't really need that. But then I was like, I want to do more medicine field. Optometry was always there. And then I started thinking, well, I could even look into family practice, other surgical options. But then I was really like, nah, I really don't want to get into the whole surgery aspect of things. And I kind of want to be kind of honed in more on a specialty. And yeah, optometry just kind of led me that way.
That sounds amazing. I think right now a lot of us aren't very sure about which. We know that we want to do healthcare, but then we aren't really sure which one to focus on. So personal things are very important. So I think going along with that, what personal characteristics do you think are required for somebody who's going into the optometry?
Okay. Well, I mean, you need to obviously know your stuff. And I have a feeling everybody in the club knows their stuff and will know their stuff once they're through all that. So I think you need to have the desire to do it, obviously. I've seen people kind of come through, whether it's my industry or other ones, where they obviously don't really have the desire to be doing that. They'd much rather be doing something else. And that's going to affect you from, patient care standpoint and just personal happiness standpoint. Got the smarts, and if you got the aptitude, to go through medicine, whether that one being specialty right off the bat, like optometry, chiropractors, dentists, or if you want to go down the whole medical field aspect, you just need to have that desire to do that. I think once you're kind of in school, I mean, a lot of people, I think I'm kind of an exception. I knew I wanted to go optometry right away, so I did my undergrad. I personally did biochemistry when I was in undergrad because I like biology, I like chemistry, so why not biochemistry? So I knew I wasn't going to go into anything that involved doing biochemistry as a profession, but I enjoyed doing it. I just knew that would kind of fulfill my requirements getting into then optometry school. But I always recommend if you're going to be looking specifically medical field, whatever the specialty happens to be, I mean, getting into college and doing one of the biology majors, one of the biology programs, you'll get in there, you'll start to get a feel for everything and kind of slowly start to make your decisions based on where you want to kind of take that path.
Absolutely. And you kind of touched on this. So would you like to tell us where you did your undergrad and where you went for school and stuff?
Yeah. My undergrad was down at the University of Wisconsin Madison. So I'm a Wisconsin kid, born and bred, graduated out of Loyal by Marshfield. And I really didn't have any thoughts about going anywhere else aside from Madison. I always wanted to do that. Loved the town, university, and so got accepted there with Madison. At the time I was going to school, this is late 90s, there weren't a lot of optometry specific schools in the country. There were only 13 in the United States at that point. So none of them in Wisconsin, of course. And so if there was one in Madison, I would not have left. But had to kind of, look outside of things. So there's a few options I kind of considered. In the end, I wanted to stay Big Ten. And so I went to Ohio State. or is that the Ohio State University? I think they send me a fine if I don't say that way. But went to Ohio State, did my 4 years over there in Columbus and loved it. I mean, it was a great school, a small school. They don't take a lot of students every year, so they really were hands-on with everybody. Once I got done in Ohio, though, I pretty much came right back to Wisconsin because I knew I wanted to be back with family, back where I grew up, and been here ever since.
That sounds amazing, and it truly sounds like a lot of places that you had to move to in order to like fulfill it. So I guess the desire does come in a lot, like into.
Mm-hmm. Yeah, you gotta know what you want to do. You don't want to be bouncing all over the place, but I always want to tell people, keep your options open. Some people don't really know where they want to go or what they want to do. And when in my story with Ohio State, it wasn't the first place I actually wanted to go. I had decided early on that no, I want to go to Pacific University over in Oregon. And it's about 40 minutes west of Portland. It's a beautiful town, but small. I was so used to Madison by that point. I got there and I looked around like, that's a nice school. It's a nice town. It's a beautiful part of the country, but I like Big Ten. I like the resource from the big university. And so then I said, okay, so where else could I go? And Ohio State was on a short list going from there. But yeah, Pacific was nice. I would have gone out there. I got accepted, but it was a little too small for me. So keep your options open just in case you don't like where you're visiting.
Especially this is important advice for all the seniors right now who are trying to shortlist which college to go to.
Mm-hmm. Do the visits, do the due diligence, check these places out. A lot online, obviously a lot of virtual stuff, a lot of videos. If you've got the luxury of being able to choose from a number of places, visit them, check them out, make sure that you would feel comfortable living in that area.
Exactly. And I think this might be your last question for the day. What is your advice to high schoolers contemplating a medical pathway?
My advice, let's find out. What would I recommend or tell you to do? I mean, obviously you guys have kind of gone a long ways already contemplating this. There's still a long ways to go. Obviously you got your undergrad and things can change in undergrad. You may start to think right now, yeah, I'm going to do medical. I'm 100% medical. You may get into undergrad. You may go through your first year and say, I don't want to do medical anymore. So it happens, and that's fine if you're going to change your mind. But if you have that path kind of in front of you, just make sure you keep your nose to the grindstone on it. I know that's very cliched, but you gotta do your work. You gotta make sure you stay to doing what you need to be doing. Some people tend to slack or tend to kind of well, I got accepted, I'm good to go. Well, you need to kind of keep pushing it. Everything has gotten. I mean, it was competitive when I was around, but I know things are so much more competitive right now. So doing the extracurriculars, doing job shadowing, different clinics, checking out on different specialties and what their normal routine is, and helping out in the community, all stuff you gotta keep on and make sure that you've got the breadth of experience, because all these places. I mean, if everybody's, got 4.0s or 4.25s or whatever the grade scale is nowadays, there's a lot of people that have got that, which is a great now, but you have, 100 people with that great GPA and they've got 42 slots. I mean, they're going to look at everything else, not just the grades. So if you have everything else to kind of fill up the resume, I mean, that goes a far way when they do their selections and interview processes.
Absolutely. And thank you so much for spending the time with us. And we really appreciate this. And would you mind if I drop your email down for anybody, whoever is interested for job shadow?
Yeah.
They are?
Yeah, go ahead. I'm always open. If people got questions, you can shoot it to the Valley Vision Eye Care email that Shrudi's got. Shoot it to me. I check it regularly. I can reach out to you. If there's anything else people have questions on, I'm certainly available.
Perfect. Thank you so much
right,
from
my
our
pleasure.
club and from St. Mary Catholic High School as well. Thank you so much.
All right, my pleasure. Thanks again, Shruti. Take care.
Bye.
Bye-bye.